Hi, everyone on TikTok and hi, everyone on Facebook. Thank you for joining. Today, we're talking about the 3-day challenge for Bond for Business, performing uh, caregiving and training caregivers to learn strategies for boosting client satisfaction, reducing uh, uh, caregiving turnover, and building a high performance caregiving environment. What are we doing for the next 3 days? Well, today is day two. We're going to cover using the bond method would transform your caregiving situation, would teach you everything you need to know about caregiving, including bond with your fellow caregivers and patients, optimize self care, and nurture your strong caregiving team, and document patient and caregiver actions. Uh, Here's a case history of a training story. The caregiver, Mary, shows up on time. Instead of three caregivers that should be on staff, only two caregivers show up. Four patients are very confused and high risk for falling. One is angry. Mary has been working for 6 months at this facility, has the most knowledge in Alzheimer's schools of the other caregiver. She has been searching for other jobs for the last month because the facility is chronically understaffed and her shift is very stressful. Caregivers don't sign out to the troublesome patients. Caregivers arrive late. Mary has to cover for the other caregivers that don't show up, and some of the caregivers are not trained. Mary has to train the new caregivers. The supervisor is not helping, not being a leader. The supervisor or the owner need to prepare these caregivers in case one doesn't show up. They need to train the caregivers so that other caregivers who have a full plate during the shift don't have to train new caregivers. For example, the caregiver can have an on call person ready to show up if a caregiver doesn't show up. Caregivers need training in such topics such as preventing falling, anger management, patient and caregiver management, patients refusing meds or foods, and caregiver self care. I have 32 years experience in internal medicine teaching in hospitals and nursing homes and families. I'm a graduate of Harvard Medical School. I've reviewed hundreds of websites and books and summarized all this knowledge so you don't have to. The main purpose of these 3 days of lectures is to avoid the cycle of high employee turnover. You hire someone, and then for multiple reasons, the caregiver quits. So then the supervisor has to advertise and rehire and interview a new caregiver that costs money. Then you have to train the caregiver, and then the other caregivers are upset because they have to do the training. So this is a vicious cycle. So you need to pick the right caregiver, you need to train them well, and encourage them to work as a team. Before you get training in business bond, there's poor relationships among caregivers and poor communication. Uh, there's poor self care, like eating donuts instead of healthy food. Um, People who start on a healthy diet immediately have better focus, better concentration, better energy. They may not lose weight right away, but their mental functioning isn't better. N stands for nurture the team. So before bond, there's not very good teamwork. And then D is for documentation. You need to document um, the patient's health. Are they getting worse or better? Are they falling, not eating? And document caregiver actions. The patient fell today. The caregiver checked for injuries. The caregiver lifted them up to the table. Caregiver did these things to improve the health of the patient. Documented, and the family comes in, and they you can tell the family what went on. This is written in a journal. so that if the next shift the family shows up 8 hours later, the next shift can explain what happened. Before the bond method, the caregiver is overwhelmed and constantly struggling to keep up with the demands of caregiving. The caregiver is perpetually in a crisis mode and cannot find a way to manage the situation effectively. This is often reinforced by negative experiences and the lack of a structured approach to caregiving. Now, after my training, there will be a good relationship between the caregiver and the patient and the supervisor. The caregiver will be encouraged to optimize self care, eat an apple instead of a donut, drinking water. That immediately will help the focus and energy level of the caregiver. Nurture a strong team, good communication um, techniques. Every caregiver doesn't learn alone. Some learn by observing, some learn by listening to the explanation, some learn with written materials. So you have to find the learning skills, the learning methods of the caregivers. And then you document the patient health and the caregiver actions. After the bond method is started, the caregiver is capable, resilient, and effective. The caregiver can manage caregiving tasks with patience and foresight. This positive identity is reinforced by their proactive habits and structured approach to caregiving. Uh, Here's some homework that you may want to do. Think of these issues so you can get the most out of these 3 days of participating. Think of issues that occur in your facility or with your caregivers, and bring this up to me. You can type them in the chat box, or you can send me an email. What are some caregiving and commission problems that you may have? What training do you provide for your caregivers? What training activities does your company provide? These are things you can think of and ask questions today or tomorrow. And now we have Brenda here to talk about her personal experiences with supervising of caregivers. Care, Brenda, if you can unmute your computer.
Okay. Um,
Thank you
so,
for joining us. Brenda, you want to talk a little bit about your situation?
yes,
Mhm.
I am with Ellis Springs Senior Living, and I've been here about 7 years now. So we've had a number of caregivers and staff that have been hired and come and gone, and we've got a good team of caregivers, and it's important to build that team that can work together.
Yeah, I
So
can vouch for a good teamwork at her facility. It's one of the best facilities I go to. I have other facilities where there's a high turnover of caregivers. So you're doing a good job. Thank you, Brenda.
thank you.
Okay.
Um,
Um, you want to start with how do you hire your caregivers?
so we advertise on Indeed for caregivers, and we have everybody come in, fill out their application. They meet with the Shanika, who is the caregiver supervisor, and they interview with her. She gives them a very good explanation of what the job is and what our expectations are. So when they come in, they know what our expectations are as far as caring for the residents. And then we do, of course, we do background checks, call previous employers, and we do drug testing as well. So all of that's done when they're before they're hired.
Very good. How about your training after they are hired? How do you handle training?
We have 3 days of on the floor training. So they train with experienced caregivers for at least 3 days, and so that they get a good idea of what is expected and what the role involves. Um, once they are once the 3 days of training are completed, if they feel that they need more training, then we will give them more training as well. We also have ongoing training. So every month we have a staff meeting, and we do trainings on transfers, or um, Dr. Herrera's actually done a training on dealing with aggressive residents. So every month there's a different training that the caregivers get. Um, and let's see.
And how do you retain the caregivers? How do you provide a good environment so they want to stay with you and they enjoy their job?
I think teamwork is a big part of it. Getting along with the other caregivers, having good leaders is very important as well. So, and communication. You've got to be able. We have an open door policy, so that's very important for the caregivers to feel that they can come and talk to any member of management about their concerns, or if they're having any issues at all, either personal or on the job. Because I do find that a lot of the caregivers have a lot going on in their personal lives as well. It's, that's important to recognize that.
And do you give them suggestions about their personal life, or you just listen to them? Or I know it must be hard, you know.
Um, a lot of it is just listening. Sometimes they just need someone to talk to. Also, we through our payroll company, the payroll company we use offers some counseling services, which has been helpful to some of the staff as well.
That's an excellent idea. It's awesome. And then what do you do about caregiver conflict? You know, the the caregiver doesn't work as a team. And it's hard for them to integrate with other people.
And we run into that sometimes. Sometimes it's just a matter of sitting down and talking together with the other team members to figure out what the problem is, why they're not working together well. Usually that will work it out. And if sometimes there are personality conflicts, and sometimes it's better for the caregiver to work a different shift if we have to
Mhm.
do that, because sometimes there are caregivers that work better with some than with others. You have to be flexible though. So,
You have a
um,
policy about caregivers who, they have to take off time with the family, their family emergencies or illnesses. Do you have like a policy,
we
call us
do
24?
we do offer, of course, PTO time off. We, if it's something that can be scheduled ahead of time, then we prefer to have it scheduled ahead of time. But if there is a problem, we want the caregivers to come in and talk to me or the other supervisors to let us know what's going on so that we can understand why they need the time off. If they're just calling in all the time, that's a concern. But if they explain it to us and let us know what's going on, then that helps.
Awesome. One of the participants asked a question. My caregiving team has a problem with communicating with upset family members. They will just sometimes just listen to the family demands and not follow protocol. Do you have any suggestions for them?
Um, yes, if there's an upset family member, I always want the caregivers to include a supervisor or manager. And there's always one of us are always available. So it's important for them to have us for that backup, because the caregivers aren't, they don't feel that's part of their role to have to be yelled at by family members sometimes. And and a lot of times the families are not really frustrated with us. They're just frustrated with the situation. Listening is important. And if the caregivers know just to listen and not I don't want to say argue, that's probably not the right word, but they just need to listen to the family member and let them know that they will pass it on to the management or they will go get a manager so that the manager can handle it.
That sounds like a very good procedure and policy you have in place that include the staff. Do you have any other comments or ideas you want to give to our audience?
Um, I think it's important in the very beginning to make sure the caregivers know that they can call on each other for help when they need help with anything. Um, and also, it's important for them to see the supervisors and the managers on the floor helping out too. A lot of times they feel like the management is just in the office all the time, and it kind of that provides a separation that shouldn't be there.
Yes, the supervisors are humans too, and the supervisors are willing to go out in the units and do work just like the caregivers. Yes, that helps
Right,
a lot.
absolutely.
So, okay. Well, I'm going to continue on with my lecture. Thank you very much, Brenda. I admire you, and I think we've known each other 3 or 4 years. And keep up the good work. Don't work too much. I know you're always working, sometimes 7 days a week.
Well,
But,
thank you.
all right,
And we appreciate everything you do for our residents.
all right. Thank you. I'm going to put you on mute.
Okay.
All right. Thank you very much, Brenda. Let's continue on. Um, Here's another case history of an employee that shows up. The new employee is gossiping, about the other employees. Uh, doesn't show up on time, not performing the task that the caregiver was trained to do. Uh, the caregiver is making sexual jokes, and so the solution is right away, immediately. You 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 take the caregiver, said this is appropriate behavior, this is what you should do, this is what you not should do, and of course you do it in private, not in public, and uh, give them immediate feedback so they know that their behavior is not acceptable. The last thing you want is one angry caregiver to bring down the whole team. If the whole team is working hard and being professional and one caregiver is not, it can bring down the whole team. So you need to give feedback right away. Why is caregiving dangerous? Caregivers have 3 times more injuries compared to all other professions in the United States. um, this is a statistic from the Department of Labor and Statistics. Um, you wouldn't think that helping an aging parent or an aging patient get dressed or take a shower is dangerous, but many caregivers suffer injuries, slips, and falls while assisting the patients on wet floors, trip hazards, and poorly lit stairways. In fact, a senior's home can sometimes be a very risky place. The bathroom is the most dangerous place in the house for people with Alzheimer's. The caregiver can have back sprains, strains, and other kinds of musculoskeletal problems. There can be injuries of the caregiver due to slipping, tripping, or falling. The caregiver can get cuts or bruises affected by recipients with dementia and Alzheimer's. The caregiver can have emotional injuries from work stress or emotional injuries from home stress. Um, Here's a case history of a caregiver who has back pain after lifting a patient. The, the patient weighs 250 pounds, and there's no other caregivers around, so she lifts the patient from the bed to the wheelchair. She has to do this 3 times on a very overweight patient, and because of the pain, the caregiver's in a bad mood and gets angry at one of the other patients. Then the caregiver refuses to lift any more patients. The other caregivers get mad because they think that that one caregiver is not doing his or her part. The caregiver calls in sick the next day due to back pain. Caregiver goes to see the doctor. The doctor orders x rays, CAT scans, and the caregiver misses 5 days of work. So the caregiver should be trained on good body mechanics, keep the back straight when lifting a patient. I'll show a picture of that in a couple of slides. And using a Hoyer lift when appropriate. Hoyer lift requires training, so don't use it unless you've been trained to do it. Light duty should be available to caregivers so they don't miss too many days at work. Um, many, uh, many, especially construction jobs, they don't have light duty, so they force the patient to take off. And caregivers need to make money; they need to pay their bills. So if a facility can have light duty doing paperwork or catching up on um, on documentation, they that should be made available. Also, you need to explain to other caregivers, look, this caregiver injured her back. Please be patient with you. Remember, one day you might get injured or you might have to take off, and we will cover for you. So explain the situation to the other caregivers. Preventing caregivers. You need to have a fall-proof bathroom. Mm. Installing grab bars, a walk-in tub or shower, a sliding shower bench. Fortunately, there are several methods and precautions you can take to prevent injuries. Also, removing trip hazard like throw rugs or step stools, and put non-skid strips, little strips here. It's about this long, and you put them on the floor instead of a rug, so that the patient and the caregiver don't slip. Caregiver injuries part two: wear proper shoes. Need tennis shoes, non-slip shoes. Uh, you equipment like a gait belt. It's like a belt for your pants. You helps you lift the patient up. Slip sheets where you can turn the patient using the sheets, not the body, and then lift devices like a Hoyer lift. Lifting techniques. Caregivers are at greatest risk of energy when they are pulling a person who is reclining in a bed to a sitting position, transferring the patient from a bed to a wheelchair, leaning over a patient for long periods of time. So they leaning over the patient because they're changing the diaper or they're putting medicine or cream on or they're uh, readjusting the patient. When you're leaning over and bending, that can cause back pain. Um, so my Zoom picture is covering this up. Let me see if I can move it. So when you lift someone from the bed, you should get your body close to their body. Don't reach out. If their body close to you, you put your one leg in between their legs. So you get close to them and you lift with your legs. Don't lift with your shoulders and arms. Uh, grab, hook your arms together and then lift with your legs. See if I can move this picture. I guess I can't move it. I'll leave it like that. Um, so keep your head and neck in proper alignment in the spine. You're lifting your head, neck, and back should be straight as possible. Reducing family complaints. Right? Communicating well with the family is so important in the caregiving facilities and when you're a provider in the home. When you're discussing family complaints, sit down, sit at the table. Don't appear to be rushed. Answer all their questions, wait in silence. Don't contradict them. If the family says, oh, you know, you didn't do the right thing, you should have prevented the fall, just listen to them and say, I understand. Let the family talk. Use the bathe technique. We'll talk about that the next slide. Be reassuring. I'm going to talk to my supervisor about this event, and we will work hard to prevent this event from coming again. And then recommend simple steps to the family. Uh, uh, First of all, remove the rug. Second of all, uh, give them Tylenol for pain. Just very simple steps. Don't just say go use the Hoyer lift without explaining things. This is from the American Academy of Family Practice. The bathe technique is how you empathize with the family, or this could even be another caregiver. Background: what's going on in your life? Could it be that the family or the caregiver is upset about something at the home? How is this situation affecting you? Are you sad, angry, depressed, crying? What troubles you most about the situation? Maybe the caregiver or the family feel helpless, or maybe they just can't bear to see their mother with Alzheimer's. Their mother used to be so strong, and now the mother is very weak. And then how they adjusting to the situation? Are they coming up with good suggestions to improve the situation, or are they repeating the same bad suggestions over and over, trying to hopefully it'll get a different situation? Empathy, when they say I feel scared, I said I understand you're feeling scared. I understand you're feeling angry. Just repeat back their emotions to them. Monthly meetings are so important. Brenda talked about this. Monthly or twice a month. This could be in person is more helpful, but it can also be by Zoom. You want to record the meeting to make it available to all employees who couldn't make it. Put it on Zoom. Zoom has automatic recording button, and you can put it on your website or on a computer in the break room or one of the offices. Review difficult or relevant caregiving situations and do role play. One caregiver will play an angry family member, and one caregiver will play the family, I mean the caregiver. Or the caregiver will pretend they're the patient with Alzheimer's, and the other caregiver pretend that they're dealing with the anger of the Alzheimer's patient. Role play is important. You don't want to have a boring lecture in your company meeting. You want to keep it active, keep it interesting so the employees pay attention and learn the best they can. Monthly meetings part 2. You want to define a collective identity of the group and help each other understand the role within the team. So, like, identity could be we're here to support the person with Alzheimer's and support the family, to educate the family on what to expect. And if you see a caregiver that needs help, help them as much as you can or ask for help from the supervisor. That's called the collective identity. You want to inspire creativity and cooperation amongst the team. You can ask team members, how would you handle this situation? Um, I feel a little bit shy about doing this. I feel I haven't had enough training. Just be open with other team members and with your supervisor. Take individual ideas. I want to help them prevent them falling, but discuss it with your supervisors and other caregivers to get their feedback on your suggestion. Clarify goals, reduce falling, increase uh, uh, feeding, increase taking the medicines, uh, having a good attitude. All these are important goals. And then the deadlines. You want to train the caregiver by the end of 3 days. You want to have the patient with Alzheimer's drinking uh, 3 glasses of water by the end of the week. Small goals and have deadlines. Monthly meetings, part three. Never publicly reprimand an employee in front of the team. Uh, do that privately. Um, and in general, try to change the employee's behavior with compliments. You did good when you prevented a fall with this patient, but when you were angry, you could have done it this way. Scolding or losing your temper with an employee does not encourage the employee to have better behavior. Acknowledge the patient role in achieving goals. Last week, we had no falls in the facility, and thank you, Betty. Thank you, Mary, for doing your job. You did such a good job. Keep the meeting short and to the point. Uh, the longer the meeting, the more people tune out. Have a call to action at the end of the meeting. Here's a handout. Please read this handout, or please work on preventing falls this week. Uh, and the supervisor should be aware of toxic or distracting employees. Employees have a bad attitude and deal with them one on one privately. Self care is very important for the caregiver. Exercising, you can do stretching during the day, just 1 minute stretching. The caregiver needs to get good sleep. Sleep after breathing, good sleep is more important than eating right and uh, and drinking fluids. Social engagement, that's very important for a caregiver to do social engagement to avoid depression, avoid stress. Emotion awareness, the caregiver and the supervisor should be aware if the caregiver is depressed, angry, upset, uh, bad attitude, and the caregiver should be aware of their own emotions. Eating healthy can improve the focus right away. That same day, even though you don't lose weight that day, it improves your focus and improve your energy level. We have a question here from the audience. Let me see what the question is. Do you have any suggestion for incentives? Uh, well, always thank them and smile them and shake their hand when something's good. And you can have employee caregiver of the month. You can give gift cards, $5, $10. You can have a free coffee day. If there's no falls for a week or 2 weeks or a month, and no one gets angry for 1 week or 2 weeks, then you have a little break party, a small little cake, you know, catering in a lunch. What are the ways you can document over the year all the good things that a caregiver did, and then once a year you have a awards meeting, and in front of the whole staff you tell them what a good job the caregivers have been. You need to be proactive. um, need to think ahead of time. What if the patient gets angry? What if the patient uh, won't eat food? What if the patient won't take the medicines? um, the caregiver needs to already have that in their mind, and that's part of the initial training. For anger, remember, use empathy, not logic. Don't say, oh, don't be angry, you have nothing to be angry about. No, say, I understand you're angry. What's going on? Are you hungry? Are you in pain? Just let them vent their feelings. When they're angry, be very agreeable. You want a zebra in the room, okay? You want to paint the the roof red. You want a steak dinner in 1 minute. Yes, we're working on that. Yes, we're going to help you work on that. the caregiver needs to have calm body language. You know, if the patient's mad and you're mad, that's just going to escalate. So calm face, calm body language. Be agreeable, give compliments. Sir, I know you're angry, but you're very young. You're very handsome. Your hair is so nice. You're very smart. Uh, what do you do about confusion? Already have this in your mind what you're going to do. Explain what's going on to the caregiver, to the person with Alzheimer's. Assess for acute disease. Sometimes confusion can be pain, can be a urine infection, can be a fever. So for that, you may need to call your supervisor or call the doctor. And if they're confused, would you like to eat? They don't understand. Well, would you like a glass of water? Would you like some applesauce? Would you like to look at photograph album first? Rephrase the question. Don't keep repeating the question. How to promote bonding with your caregivers. You need to use the relationship with your caregivers to form a good team. Every caregiver learns different. Some learn by reading, some learn by looking, some learn by observing. So you need to be patient with your fellow caregivers and listen to their body language, listen and try to find out what's going on with them. You treat every caregiver differently depending on their personality. If one of your caregivers is angry, you just listen to them. Oh, I see you're angry. Oh, I see you're depressed. Oh, I see. Just repeat their feelings back to them. Don't tell the caregiver, you have nothing to be angry about. You have a great job. You know, you're this. They'll just repeat their emotions back to them. Focus on building the strong and open communication with between the caregivers. That relationship will get you far as working as a team. Practice exercises, active listening, look at them in the eyes, empathy. I'm sorry you feel this way. Tell me how you're feeling. And finding joy in the little moments. I know you're upset, but you have great hair. I know you're upset, but those are cool shoes. Uh, Smiling when appropriate will help the team bonding better. Be proactive. Uh, have it in your mind what to do if the patient refuses medicines, refuses to eat, elopement. I'm available for VIP sessions to talk about how to arrange caregiving training for your company. I'm available today, or you can email me or make a message in the chat box and I'll set up an appointment with you. Uh, your caregiving situation is urgent. Don't wait till there's a crisis in your company. Don't wait till your caregiver quits. Do training today. Reach out to Ray and that you can put a message in the chat box. We will get back to you. It's priceless to have a strong caregiving team. Here's homework for tomorrow. What are some of the caregiver communication problems you have? What training do you provide for your caregivers to work as a team? What training activities does your company provide? Uh, some some business persons say, well, I don't have enough money to pay you, Dr. Rivera, but what's the cost of the training? We give you a free 30-minute session with your staff to see if you like Dr. Herrera and his staff. If you order before November 21st, we'll give you $100 per hour for group online training. This includes membership in the VIP caregiving group with educational videos. The time of the session can be tailored to when is convenient for your staff. You want noontime or 5 p.m., and then we record this session and make it available to your caregivers. I recommend giving caregivers a gift for attending educational seminars, like a $50 care gift card if you attend 4 hours, pedicure, dinner. The value of this is $500, but I'm offering it for $100. Thank you for your comments. I also have a caregiver training community. So Facebook, you ask to come on online to be a member. We have a free one, and then we have one that has much more training, recorded videos, and if you spend $300 in training, then this caregiving community is free. If you would just like to just join the caregiving community for your business, that will be $99 per month for 3 months, and then it goes up to $300 a month for all your for all your employees. This caregiving community includes anger management ebook, health assessment form, and a caregiver action documentation sheet. What's the cost of not doing training? What if the caregiver gets upset because of lack of teamwork? Caregiver quits. You have to interview another caregiver. You have to process them. You have to retrain them. What's the cost of that? $5,000 or more. You lose a client. You have a caregiver in a home and the caregiver doesn't do a good job. The the family picks another agency. How much does it take to get another family? And what are the time? If it takes you 3 months to find another family, how much have they been paying you all this time? And if heaven forbid there be a lawsuit, the caregiver does negligent work, they're going to sue the company. Attorney's fees, owner deposition, penalties from the state, bad publicity, that can be $100,000 or more. So, for summary, the focus of caregiving training should be good bonding relationship between caregiver, patient, family, and supervisor. You need to promote good, strong team cooperation. You need to prevent caregiving injuries. The caregiver and the supervisor need to be proactive and perform self care. The cost of training is much less than the cost of caregiver turnover, rehiring, retraining, and family complaints. Thank you very much for attending. I'll see you next time. We're meeting tomorrow again at 6 p.m. Bye bye. Thank you.